Hello and welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and I'm delighted today to have two guests who are joining us from the Owen Sound retirement community. On my immediate right, I have Pam Morton, who is marketing manager, and right beside Pam, Amanda Wright, who is recovering from a cold or in the process of, so she's warned me already she may cough, so we're fine with that. We understand these things. And Amanda's title is Restorative Care Coordinator. So I want to thank you both for being here today.
Thank you,
and
Carol,
I understand,
for having us.
My pleasure. So really, you're here to actually talk about retirement home services, but you're affiliated with 3 different retirement homes. Tell me what they are.
Yes. Owen Sound Retirement is the corporate name, so under that we have John Joseph Place, Hannah Walker Place, and Kelso Pines. So the 3 facilities, and they're located in just right down, John Joseph Place and Hannah Walker Place are just in behind the public library.
Okay.
And Kelso Pines is across from Timothy Christian School.
Okay.
Yeah, so
right
they're
in Owen Sound itself.
Yep, close to downtown, the library, all the places that you might want to go downtown, nice and close, so perfect location.
So tell me what the difference is between a retirement home and a nursing home. What's the difference?
The nursing home is subsidized by the government.
Okay.
So folks that are interested in that would have to access the Community Care Access Center.
Okay, to actually get into a nursing home.
Yes.
Or long-term care facility, I think is the official term, right?
Yes, yeah. And from that they would go and speak to a care coordinator with CCAC.
Okay.
And they, at that point, would determine their eligibility. They would work with them to go through the process in terms of getting into long-term care and whether they would even be eligible.
Okay.
Retirement homes are still privately owned, but they are under government regulations and legislation. So there's
they're not funded by the government?
No.
Okay,
no,
but nursing homes are?
Yes.
Okay.
Yeah.
All right.
So with retirement homes, there's been many changes over the last 5 years, and our facilities have been working really hard to get those policies into place through legislation. And Amanda knows those policies fairly well and has had to work through them to meet the guidelines and standards that have been put in place.
So for me, if I wanted to get into a retirement home, I don't have to go through CCAC.
No.
To go into a nursing home, I do.
No. Now you may have, if an individual is at home, they may have contact with their care coordinator who may have advised them of different retirement homes that they could go and look at, or give them names or contacts to help them with that.
Okay.
But they don't, you know, an individual can go on their own to look at all the different facilities, and there's no 2 retirement homes that are alike. They're all very different. So it's wise to go and see what best meets your needs and what you're looking for, and ask the questions. So.
What are some of the questions people ask you when they're trying to decide? I imagine it varies from person to person. Like, how do they make the decision?
I think that they look at all the retirement homes. There are so many choices out there.
Yeah.
So they come in, they like to tour our facilities. Some people even come and they have a lunch or a supper date to try our meals, because
meals would be important.
Meals are very important.
Yeah.
Meals are very important.
Okay.
Our services that we do provide, the services in our home, we have 24-hour nursing care. We do have, you know, RPNs on staff, PSWs, healthcare aides. So activation.
Activation's a big piece of it.
And they want to know what we're going to do during the day, what programs are going to be available.
Right, right.
And on the flip side of that too, some folks come in and, you know, you can make it whatever you want. If you want to be the busiest person and get involved in everything, you can do that. If you're someone that hasn't, you know, been involved in activities and is a little more recluse or keeps to themselves, they have that option. So it's not like, you know, you're going into a home and you're expected to participate in these programs. It's really geared to whatever your comfort level is.
So you're mentioning that there are 3 homes in Owen Sound Retirement Corporation. But what I'm hearing you say is those 3 homes could be totally different from each other.
Yes.
And so even within one segment of the retirement home population, people would need to visit as many as they can to really get a feel for it. Okay.
Yeah. Yes.
I imagine it's a tough decision for people to make.
It is a very tough decision.
Yeah.
But we often get too, you know, I was hesitant to come in here, I was a bit reluctant, but once they get settled and get in there, and they often know people that are in the facility, and they, you know, get themselves established and develop a routine there, and again, because the facilities, ours in particular, are different sizes, some folks might want a smaller setting, cozy, you know, comfortable, they get to know the staff really well. Other folks want something that's a little more elaborate. And that's, you know, those are options too. So it really is geared to that person's, their makeup, what makes, you know, the choices that
matches the personality.
Yeah, for sure. Yeah.
If I was to make a decision and go into a retirement home, how would I get to doctor's appointments and how would I get out shopping? Is there anything available for me?
We do. We have staff that do run appointments.
Okay.
To doctor's offices. We do have activation that takes weekly bus trips to the mall, local stores.
Tim Hortons.
Yeah, of course, that's a big one.
Yes, not always.
That's not a plug. There are other places.
They do go weekly for coffee.
Okay,
Out
so
for
outings.
coffee.
I guess that would be fair to say. They do outings.
Ice cream. Sometimes in the summer they do drive to Sable Beach to have ice cream. So.
They just did a fall leaf tour this week as well.
So lots of options, not just being in the building.
No.
But there's options to being out and about as well. Which is really, really good to know that transportation, because sometimes people make a decision not to drive anymore.
Well, and we often find too that folks, if they've been in their own home, they actually do even better because in their home there isn't as much room to walk around and get from point A to B, so it increases their walking tolerance because they're doing the hallways and then socializing. They're out and about more, so they feel better because they're with people, and so often when they do come into the facility, they do excel because they have all those different opportunities for them to flourish and get better.
So on that note, we're going to pause and then come back, and I have questions about specific programs you offer. Thank you for joining us in HealthLink. Please come back shortly to learn more about retirement homes in your community. Take care. Don't mind me.
No, you go ahead and do what you
What I want is... Can you count to 10, Amanda? They want to check your mic.
Okay, 1, 2, 3.
Thank you for joining us here on HealthLink. Today we're learning about retirement homes and the programs and services that they offer. Right next to me I have Pam Morton, and next to Pam is Amanda Wright. So thank you both very much for joining me.
Thank you for having us. We're pleased to be here.
Thank you. Now I have some questions for you. Get ready. I understand that there are some new programs actually, and right now we're talking specifically about 3 retirement homes. Maybe we should identify those for the people who've just joined the program. So what 3 homes are we talking about?
We're talking about John Joseph Place, Hannah Walker Place, and Kelso Pines.
Okay, excellent. So I understand that there are new programs coming. So restorative care.
Yes, that's a big one, and we've worked hard on that within our facilities, and Amanda's done a fabulous job. She's our restorative care coordinator, and she's also a nurse, RPN, so it's fantastic to have her skills. And she's been working with external providers through CCAC in closing the gap with physiotherapy services, and I think you do a little bit with the occupational therapists as well.
Okay,
so I'll let Amanda talk about the services that she's actually doing, because she knows it best.
So what does restorative care really mean?
Restorative care is exercise.
Okay.
It's getting people back to where they once were if they've had surgery. It could be maintaining a level of activities of their daily living. So walking tolerance, as Pam had talked about earlier.
And the biggest thing too is their functional, their day-to-day functional levels, those sorts of things.
Okay.
Yeah.
So it's more than activation.
It is.
It has a focus.
It does.
Yeah, they're very goal-oriented to specific, whatever is identified by the physiotherapist.
Okay.
What those goals, or the occupational therapist, what they are, and working with the therapist to identify those and work with the client and to build them back up to their full potential.
Yeah. Are you seeing a lot of people who require restorative care?
We are seeing more and more. We are getting a lot of temporary stays is something we do offer. People who have had hip surgery, knee surgery, so they need just a short-term stay to get back on their feet before they go home. When they're in the hospital, they are set up with CCAC, who then sends a physiotherapist into one of our homes. I will meet with the physiotherapist and the client, and we develop a plan, an exercise plan, goals that they need to meet before they can go home.
So in other words, you don't have to really move into a retirement home to actually be able to use retirement home services. It can be a stepping stone to getting back home again.
It can be a stepping stone. It can be a short-term stay just to meet your goals, not to have to go home and get yourself feeling better, plus the challenges of doing the housework and preparing meals on top.
I could see that would have a real advantage for people, and especially for those people whose families aren't close by.
Yes, it does.
It must give them peace of mind to know that their loved one is being cared for.
And for the client themselves as well, you know, having a feeling that I'm not having to burden my family. I have the resources here that I can use and get better, and just keep plowing forward to get back home where they want to be and get them to potential. So,
do you find that people are surprised that a retirement home offers that kind of a program?
I think it is. I think that there has been so many changes in retirement homes. A long time ago, if a retirement home was just for people that needed maybe a little bit of help with cooking and cleaning came. Now we offer so many different levels of care. We offer care from the retirement home level, people that require help maybe getting dressed or showering. We do have nursing staff that will assist them with that. We also do offer end-of-life care. So we do have staff that do specialize in palliative care. So we have people that move in, and as they age, they don't want to leave their home. So they will stay in their home until the end.
The retirement home becomes their home.
It is their home.
It
is their home. All our rooms are private. They're welcome to bring in their own furniture and make it their own space.
Now, what about people who are confused, the wanderers, and do you offer a service for that?
We do. We have
the specialized dementia unit.
Okay.
So those folks, we've got that at John Joseph Place and Castle Pines.
Okay.
And so the staff are trained, they have extra training to work with those individuals.
So does every retirement home, obviously not, then if you have 3 but only 2 offer that program?
Yeah, and again, their retirement homes are so different.
Okay.
So you really need to go and explore, check them out, see what services they offer.
Okay.
It's very important because they are so very different.
So you would encourage people to call or go on the website and
and come and see, and see us and have the tour, look around, definitely ask the questions.
Yeah. What about people who only want a few months a year to have a place to stay? Do you offer that as well?
We do. We have a lot that come in for the winter.
Really?
We do. It sometimes gets to be a little bit much to have to worry about shoveling, going out for doctor's appointments.
Last winter.
Yeah. Oh, last winter was quite a winter.
Yeah. So you also offer a facility for people who just want a few months.
A few months stay, yes.
So they're not committing to anything.
They're not.
They just need that time to be able to be taken care of and not have to worry about snow shoveling or whatever.
And going out in the winter to get their groceries, things like that.
Okay.
Yeah.
And it's a nice way for them to try it and spend a couple months, see what they think of it, and then go home. And as time goes on, if their health does deteriorate or they need a little extra care, they've been there, they're comfortable, they know what the experience was like, and
I would think that would help with the decision making, that it gives you time, your transition a little bit easier at that point in time.
Yeah.
And just as we're talking about short-term stays, we do offer also with our
restorative care program,
restorative care, the short-term for surgery, but we also have relief for caregivers. So if you have a loved one that maybe has dementia and you're caring for them at home, but you need to maybe go away on a trip or take a few days to do something for yourself, we do have people that come and bring a loved one for a week, a weekend, a few days.
Wow.
So we do.
Now, is that what they call respite care, or do you call it relief? Like, is it?
We do use the term respite care, but it is relief care as well for somebody taking care of a loved one at home.
So you offer so many different levels and so many different approaches, rather than just making a decision to move in.
That's right.
Wow, that is a significant change. So going back to the restorative care program, because we have a lot of older people who choose to have joint replacements, or what sorts of service would they get? I mean, how are you set up to take care of those types of people? What do you do?
So we do have nursing care. So of course, when they come in, we're going to make sure that the nurses are aware if they have any dressings that need to be done. We do wound care.
Okay.
So we're watching their surgical sites.
Okay.
We do work along, of course, with CCAC to bring in physiotherapy, an occupational therapist if they need something, a walking aid, a gait aid. A wheelchair for a short time.
And we've just established, we're very proud, we've just established our new restorative care suite.
I'm very excited about it.
Yes, a suite, yes. And within that suite they have, we're hoping we have all the things that the physiotherapist or occupational therapist would need, which would be exercise bands, balls, bed helper rails, lifts for the chair.
So you've got that in place already?
We've got that all in place. So it makes it so much nicer for the individual coming in. They don't have to worry about that. And for the external provider coming in, we're hoping that that will help them as well, and not have to, do the extra legwork. It's all there for them to.
And that, to me, would save a lot of last-minute stress for people scurrying around to get it in place. So you've got it in place already. A lot of peace of mind, I would think, for people for that. So you also, with nursing care, would be able to take out the staples?
We do.
They don't even have to go?
They don't have to. We will drive them back to their follow-up appointments, of course. I myself would then work with them on their program set out by the physiotherapist to get them back to where they need to be to go home.
So they would just simply have to focus on recovery and getting where they need to be.
Need to go.
So that's actually quite exciting to be able to offer that.
We're very excited.
We are. We are.
And I'm not sure, I'm delighted to have you on the show because I'm not sure that that's well known, that that service is available. So,
And it's just been recently new for us to establish that. So
we have hot off the
press. Right off
hot
the press.
Off the press. Good news. Good news.
The restorative care also helps the residents that we already have in the facility as well with what we call maintenance. So keeping them walking so they're not having increased falls. We do have VON that comes in to all 3 of our buildings to do a group exercise program. They come in about an hour twice a week, each facility.
So lots of options for people to choose to either prevent decline or to get back to where they can be, to go home, which is really good. From your experience, what are some of the successes that you've come across in retirement home settings that most have an impact on you?
I think I know in some of the facilities they've actually been able to have people come from surgical procedure and regain full strength and be able to go home. And often they may go home, but as we talked about before, they may come back for the winter months because they don't want to struggle with the winter. So they make a full recovery, and they're, when they come back, they're happy to come back. The staff are happy to have them back, and they settle in nicely. They stay for the winter, and they may go again. But it's nice to be able to bring somebody in and see them be so successful and be able to get home into their own.
That would be rewarding for both the individual and the staff.
Yeah,
really.
oh, for sure. Yeah, most definitely.
Yeah. So it sounds as if in a retirement home setting, it does become almost a family of a different sort.
Yeah, it does.
Where that relationship starts to build.
Yeah. And in our facilities, we've had the management staff have been there for years, for quite a long time. So they really know the facilities well, and they know all the ins and outs. So if family and residents have questions, they're usually on it, so they know. You know, they've heard the question before, and they're usually ahead of the game on that. So
it also says a lot when you have management that stays with a facility. I mean, obviously that speaks volumes.
Yeah,
through the changes and guiding the changes as well. Yeah, for sure. What other changes have you noticed, or do you anticipate in the future?
I think there'll be continuous changes with the RHRA, which is the Retirement Home Regulatory Authority. That's the new licensing that has been put in place.
So that is new. Now retirement homes have to be licensed?
They have to be licensed.
Before they didn't?
No, and it came into effect 2010, and we're very proud to say that we were the first facilities in Owen Sound to be licensed.
Great. That is something to be proud of.
Yeah, so it's an accomplishment for us. So,
So, which means now that you have to abide by certain standards.
Yes. Yeah. And I think those will change over time. So we're constantly trying to be on top of that. And make the changes as we need to. So.
Yeah. What do families say about the experience when they have loved ones? What's the feedback from family?
I think we get quite close with the family, actually. As Pam had said, we have a lot of our management that have been there for years, but we have a lot of staff that have been with our facility, some of them upwards to 18 years.
Wow.
So you get very close with the families. You get to know all about their grandkids, their kids' names.
Yes.
And I
the
think
important things in life.
It is like a family.
So, and I think the word home on retirement homes certainly says it for sure.
And I think families are relieved knowing that their loved one is in a good spot. They're cared for. They don't have the stress of, worrying, if they're at home, are they getting their medications? Have they fallen? Are they eating properly? They know all that's looked after. And so.
I can't imagine a more awful feeling for a family to know that someone has fallen and been there for a
Yeah.
while.
Yes.
So at least the eyes would be on them. They would be monitored on a regular
They
basis.
are. We have
Yeah.
the call bell system, the alert system. All our residents are given an alert button when they move in, so they just have to ring if there's any problem, even if they need something.
Right.
They just ring for us, and a nursing staff member would come
Yeah.
and help them out.
Yeah. And they dine in a room together.
We do have a large dining room.
Yeah.
Most of the residents do come down for their meals. We do
Right.
have some that are late risers that would prefer to
A
have a
tray.
breakfast
They have their
tray.
beauty sleep, do they?
That's
Yes.
right. They like
Yeah.
to get their beauty sleep.
But you offer that option then?
We do
Yeah.
offer that option.
Yeah.
We do offer the option. Some people never ate breakfast in their life. So
Okay.
if you
That's
don't
right.
want to get up and come down for
Yeah.
breakfast,
That's a
it's
big
your
one.
home. You
Yeah.
can make that
So they
decision.
get, really?
Yeah, they
so
can,
they really
yeah.
have that choice.
They have
Yeah.
that choice.
Yeah.
We do have some, as Pam had said, that are a little bit more recluse.
Right.
And they don't want to eat in a large dining room. We do
They're not
offer a
comfortable.
tray service.
So it sounds like their dignity is being respected and their
Very much
lifestyle
so.
is
That's
being
right.
respected,
Very
even
much.
within a home where there are others as well.
Yeah.
Yeah, which makes it really, really helpful. Anything else in the last minute or so of our program that you'd like to share? Because we're running out of time.
Oh, well, we would just hope that if you are interested in looking at retirement homes or, you know, just wanting to start to look, you know, come and visit us. We'd be happy to provide whatever information they might be looking for, and you can come back once or twice, and as Amanda said, stay for a meal,
Stay for a
stay
meal,
for a
yeah.
program. Just come and visit us. We'd be
Yeah.
happy to see them.
Which I think is really great advice because, you know, when you're making a decision, you need
It's
to,
a big decision,
to
yeah.
weigh the pros and cons, and being able to, for family to come as well
For sure.
would be really important. So I really want to thank both of you for joining me today. I've learned a lot for sure, and I think
thank
it really helps when people are informed about
Oh.
the choices that they make.
Well, we're
So-
pleased to be here and be able to share those
Super.
services that we offer.
And
so-
you have a picture here, which
Yes,
is lovely of the
yes,
homes as well.
Yes.
So I want to thank you for joining us here on HealthLink. Please join us again to learn more about programs and services available to you and your family. Take care.